with the restrictions coming tomorrow, we hear a lot from people saying, oh, I just want to go to my cabin. It's just outside the community. Or I'm just going to go to a campground. I'm not going to see anyone. I'm going to bring my own food. Why can't I do that? Can you explain why people can't just do these, I'm just going to do this one thing, why that it could be damaging, why you're making this decision to halt travel between communities?
Yeah, you know what? This is not forever, as I've said many times. But for this next period of time, yes, go camping, but go camping within your area. Don't go to an area with high transmission. And right now, we know that the highest rates of transmission are in the Lower Mainland. So we're really focusing on reducing people's travel in and out of the what we call the Fraser-Vancouver health regions. There'll be more details about this, but obviously there are some areas that are more connected to the interior, to the north, and here on Vancouver Island. So yes, if you are somebody who goes camping by themselves or with your family, not interacting in the community, do it within your local region. And we know that many people had booked to go to different parts of the province. We're asking campsites and we're working with the tourism sector to keep it local. So that you should have access to your local campsite, not the one that's a ferry ride away or a distance away to travel. So that's what we all need to do right now. And yes, it seems like it's okay if it's just me and just my camping, but we need to recognize that that translates into many more people making exceptions for themselves. Between now and the end of the May long weekend, we all need to stay local, stay within our own area.
Lisa, do you have a follow-up?
Yes, looking at the hospitalizations increasing and the most recent surveillance report, seeing the tragic death of the child under 2 and also someone in their 20s, with hospitalizations being a lag indicator and then death following that, I'm just wondering how devastating it's going to be in the weeks to come.
Yeah, everything that we do and the things that we know about our healthcare teams, those are the things that give me hope. And that's why I am appealing to everybody to just, that we're at a point where we have seen hospitalizations for the first time that are causing this type of distress and challenges to our healthcare system. But we know that they are providing the best care possible, that every day there are people going in and out of hospital that are being supported, that are getting the care that they need. That is why right now we have to take extra measures to stay local, to stay within our households, to stop transmission. Because yes, we are going to see more people in hospital over the next few weeks, but as we've seen things start to slow down, we expect that we'll see hospitalization start to slow down. But it is at the point now where we have had to stop scheduled surgeries so that we can give people what they need to be able to care for people who are in hospital right now. And when I talk to my colleagues who are working in critical care, who are working in the ICU, who are working on the wards and working in the emergency departments, they want people to pay attention now because we know what we need to do to stop this transmission, and we need to give them a break.